The New South Wales government says they are following the best health advice. Yet every day we are seeing high case numbers and cases that have been in the community while infectious. Would it not have been more effective to have locked down Sydney earlier? Even now, large retail chains remain open when they have online presence and delivery capability. This gives an avenue for people to move around, thereby curtailing any large reduction in community cases. Shouldn't further restrictions be introduced now for this last week of lockdown?
Katie Allen, let me go to you first on this. You've lived through tougher lockdowns in Melbourne, obviously. Do you think New South Wales, the Premier Gladys Berejiklian, should have gone earlier and harder with this lockdown?
Look, I think, David, Karen's question is one that faces, everybody around the globe, and you need to look at the decisions and the balance that a government is making. And, I really back in Gladys's decision-making to this point. She would have been making that decision with her cabinet apprised of the fact that they've got a crack COVID contact tracing team, but they've also got shifting sands if you look at the Delta variant, and you also look at the compliance in the community. I think things are changing, and so you could say we could have done this, but they're balancing lives and livelihoods, and that's a difficult balance to make. And I think if it was for free, if you didn't have the emotional and economic consequences of a lockdown, I'm sure they probably would have locked down earlier, but you have to balance those many difficult things in the one decision making, and that risk balance ratio is why we look to our governments to make those decisions. They're not easy.
No, they're not easy decisions, but with 38 cases recorded yesterday, 11 of them were in the community while they were infectious. There are still, no restrictions on how far people can travel across Sydney. Shops like florists and designer handbag stores are still open. I mean, do you think this is really gold standard when it comes to this Delta variant?
Well, I actually think that we are seeing around the world a change in the risk balance ratio. And, I know that we have a little way to go with regards to the vaccination uptake. But what I would say is we are seeing high rates of vaccination in our most vulnerable population. And I've always argued that the target should be around preventing deaths, because we know that the vaccine is most effective in preventing deaths. It's not actually as effective in preventing cases, and we don't really know whether it's good at preventing infections. So we really want to make sure we don't have deaths from COVID, and so we are getting high rates. More than 70% of the over 70-year-olds are now vaccinated. That is where the deaths occur. So that's where I think we're seeing a change in the balance in the equation, and we're seeing countries like Singapore making different decisions, and I think Australia needs to have that conversation.
And I think we're going to come to the vaccination debate, but Cameron, let me come to you, because you've just come back from the United States. It's a very different approach to COVID in Australia. And each lockdown, we do see, an inevitable debate about whether it should have happened sooner, later, harder, weaker. What have you made of how New South Wales and Gladys Berejiklian in particular is handling this outbreak?
Look, I think New South Wales has generally tended to be more reluctant to lock down quickly than the other states, and I've always thought that that's a better approach. Where this goes from here, who really knows? But it's certainly been, it's certainly a vastly different approach to this whole pandemic in the United States, and the experience of the US versus Australia, where I've spent the last 4 years in the US. And really, over there, they got it all wrong last year. They absolutely mucked it up from the White House downwards, and Australia got it right. I remember being in Washington, feeling quite proud and envious of Australia's ability to to do much better than the rest of the world in relation to the pandemic last year. But now it seems that the tables have almost completely turned. In the US, the US is almost awash with vaccines. Most people in America over the age of 12 who wants a vaccine can have it. The country is free. It's flying around. There's no lockdowns. They can even go to Europe. Britain in a week's time will unhatch the country as well. Here in Australia, our largest city is locked down. Our second largest city, Melbourne, was locked down a few weeks ago. Brisbane locked down as well. And so really, the contrast is very vast, and with the vaccines...
But just on that, I mean, people aren't dying in Australia.
No,
certainly,
that's right.
Compared to those countries you mentioned, the US and the UK, sure, they may be opening up. They've still got plenty of COVID.
And plenty of deaths.
And plenty of deaths.
No, not that many deaths compared to what there was, but still proportionally, it's much, much better over there. The freedom is coming. I'm not saying that should be the case now. I think that Sydney has to lock down under the circumstances. But it's very frustrating that Australia is so far behind the 8 ball with timing on this stuff.
Peter, I mean, you've witnessed these lockdowns since the pandemic began, and certainly here in Melbourne, we went through a very long one last year. They have been debated each time. Do you think it is becoming clearer whether lockdowns and how they're applied, the rights and wrongs, going early, going hard, is that becoming more straightforward as to what should be done by premiers?
I think it is clearer, and I think it's clear that the Victorian lockdowns, which were much tougher and went earlier, and the recent one went early but was fairly short, have worked better than what the New South Wales government has been doing, where I think they have been too soft and too slow, and now they're getting the consequences of it. And I think you can't really make the comparison with the United States or the UK, because we have a chance of eliminating the virus. As we, in Victoria, we haven't had any local cases of transmission for the last 8 days. Whereas, there's no chance in Europe or the United States that they are going to eliminate the virus. They have to get out of it through vaccination. I agree that we've done quite badly in terms of vaccination, and we are lagging far behind. But still, we're better off in having very few, or in some cases 0 cases, and we can achieve that with these tough short lockdowns and with better quarantine, which is the other thing we've stuffed up. If we had more remote quarantine stations, we wouldn't have the same high risk of the leakages that we're having into the larger community.
Just on the point you raised there about pursuing 0 cases, it still seems a little fuzzy in New South Wales as to whether that's what is being pursued here, 0 community transmission. I know this was asked a number of times of the Premier today. Is it clear now that's what we should be pursuing? Katie Allen, just back to you on that.
Look, I think there has been in Victoria this concept, I think, unsaid concept about going for complete elimination. And I think that the Premier never quite said that, but some of his public health servants did. He wasn't straight with the community about that. So I think there was a dissonance between what National Cabinet, with all the premiers and territory leaders and the Prime Minister, were saying inside that room, and then coming out and we're getting a dissonance with regards to that. And I think that it's actually naive to think that we would eliminate COVID. I think that's actually a very public health naive approach, and that is not the conversation that the National Cabinet has had with the Australian public, and I think it's actually unfair when people
But it has been the case in different states for quite long periods of time.
We still continue to have people returning home from overseas.
Exactly. That's right. And if we had
and what you're suggesting is unconstitutional. You're saying citizens should not be allowed to return to Australia. Is that what you're saying?
No, I'm saying they should return to Australia, but we should have, like Howard Springs, which, as I understand it, hasn't leaked.
Absolutely.
We should have. Thank you. Yeah, you would know much more about that, of course,
Absolutely.
Senator.
I agree with you, Peter. Absolutely.
Senator, I'll come to you in just a moment. I just want to be clear about this point. Many of the states have effectively pursued 0 COVID.
Community outbreaks, which is very different.
You still get outbreaks, but they try to squash them and get down to 0 in the community.
I've always said from the very get-go that quarantining is a human interface. And I've been on the board of a local hospital, and every human interface has accidents. Just a fact of life. 350,000 people coming through quarantine facilities, 3,500 of those being COVID positive, and knowing that the incubation period for COVID is longer than 14 days in 1 in 100 cases, it's naive to think it's not going to leak. And the Howard Springs quarantining facilities had rapid antigen testing. That is what is distinctly different from the other forms of quarantining. So there are many things that we can continue to improve with regards to quarantining, and we should.
Yeah, and I think we've got a few separate issues.
But we've always got to have
here.
many layers of protection. It's not one thing that's going to have sorted this out.
There's a few issues in the mix here, and quarantine's one of them. But when there is an outbreak, like we have in Sydney at the moment, should a lockdown persist until there is 0 community transmission?
Well, actually, when the last lockdown occurred in Melbourne, the messaging that came from the state government was, we will lock down until we get control of contact tracing. That's what they said. Until we get control of contact tracing. Now,
so
they are in charge of knowing what their numbers are. They are in charge of knowing how much their crack teams are going out there and actually getting control of it. And they also understand the community consent to doing that as well. And that is changing as we speak, as is the expectations of what can be achieved and what is achieved.
Senator, is it clear to you whether pursuing 0 community transmission is or should be the goal?
David, what's clear to me is that here in the Northern Territory, we were the first to lock down immediately at the beginning of the pandemic because we were conscious of the vulnerabilities here in the Territory. And only last week, we immediately locked down with the Tanami gold mine outbreak. So clearly, and locking down is important if we want to eliminate the issue at hand straight away. And we've shown that, and we've also shown that in terms of the quarantine facility that we have here. Why hasn't the federal government rolled out a similar style Howard Springs quarantine facility in the capital cities across Australia?
Well, it's a question that's constantly raised, and well, I don't know if Katie Allen, you wanted to respond to that.
Yeah, I do actually. And are you asking that we stand down the hotel quarantining system as well?
Well, the hotel quarantine system is clearly not working, is it?
I haven't heard
Katie?
one politician suggest that we close them down. Are you suggesting we close down hotel quarantining tomorrow?
Well, those hotel quarantine systems
when we have
are
more
for tourists.
ones
We'll just let the Senator respond to that. Sorry, Senator McCarthy.
So what I'm saying, Katie, is that the coalition government in 2007 was able to, and I use this as an example logistically, was able to roll out over 200 demountables right across the Northern Territory in remote regions of the Northern Territory under the Northern Territory intervention. And yet it is very incapable of rolling out across the capital cities, which are not in rural and remote areas of Australia, a quarantine system very similar to the Howard Springs facility. There is no urgency to this government in wanting to ensure that we have the most appropriate quarantine facilities for all Australians and for those Australians who want to come back from overseas.